Okay, welcome back. Now we'll talk about the cervical traction unit. So this, you're going to use the same unit, and you have this attachment here, and we'll kind of talk about how that goes on and off, because there's a little bit of a trick of getting it locked in there, and setting your patient up. So this is what I was talking about. This has the occipital halter so that it takes the pressure off of the jaw, which is really great, so you don't get any of those issues that we used to get with the old halter style one. And usually we put a little towel under here just for hygienic sake, and also in here. You want to just tighten this up till it's just a little bit snug. The angle here, it'll be able to show you where you're at. And so again, the more flexion you're in, the farther down the cervical spine, the more neutral this is, the more the upper cervical spine you're going to target. So here's the parameters for both. This also is in Cameron, and we'll have this in the lab as well for you to kind of help you to start to solidify what parameters you use for what type of goals. So in that initial acute phase, which we talked about, is after about day 3, with the lumbar spine. So realize this is the lumbar spine that we're talking about. It's about somewhere between 29 and 44 pounds. It's static, and its total treatment time is 5 to 10 minutes. So you also need to realize that when we're talking about this, if you have a very tiny person, you're going to adjust this weight, but this is for the average weighted person. If you want joint distraction, so those would be those epiphyseal joints that we talked about, you need about 50% of their body weight, right? And this one, you're going to do that on off is going to be about the same time period. So it's going to be about 15 seconds on and 15 seconds off, and the treatment time is anywhere from 20 to 30 minutes. We generally start out with 5 to 10 minutes, and depending on the patient's response to that, we can increase that to somewhere between 20 and 30 minutes. I don't usually do more than 20 minutes in the clinic, but we could talk to Dr. Smith and Professor Eckert to see if they do 30-minute treatments and why they would do that. We can also use traction to decrease muscle spasms. With that, we're not going to have quite the same force. Remember, we're going to just be trying to thinking about that gentle stretching motion. So this is going to be that 25% of the body weight. This is more of 5 seconds on, 5 seconds off. So this is kind of more that oscillation like we get when we're trying to facilitate the mechanoreceptors with those grade 1 and 2 joint mobilizations we do with the peripheral joints. And again, this is 20 to 30-minute treatment, okay? For disc problems or soft tissue stretch, again, the force is going to be the same as with muscle spasms. It's, again, less than the joint distraction. It's about 25% of their body weight. But with this one, you want a longer hold time, right? So we're wanting to hold that for 60 seconds, and then you're going to relax for 20 seconds. You're going to hold for 60 seconds, and you're going to relax for 20 seconds to get the effect on the disc or the soft tissue. And again, that's 20 to 30 minutes, okay? With cervical traction, obviously, those are smaller joints, so you're not going to need as much. And so you want to start, again, we want to make sure we've ruled out that there's no vertebral artery or alar ligament instability before we put somebody on cervical traction. That initial phase, they're going to be static again for 5 to 10 minute trial, and that's somewhere between 7 and 9 pounds. And again, I behoove you to look at the size of your patient. If you have somebody who's fairly petite, you're going to want to be a little bit more conservative with them. With joint distraction, it's 7% of their body weight, so that can vary a little bit between person to person. Again, the parameters are going to be the same. When you're doing joint distraction, for the lumbar spine, it has to be 50% of your body weight. For the cervical, it's 7% of your body weight. There's still going to be a 15-15 hold relax time for both of them, and the treatment time is exactly the same. For decreased muscle spasm, again, the hold relax time is the same, but here you're doing 11 to 15 pounds, okay? Because the head averages around 10 pounds, I think, so you're just doing a little bit more than that, all right? In order to just get a little bit of relaxation, and you're doing more of that oscillation, 5 on, 5 off. With the disc problems or soft tissue, again, it's that long hold of 60 seconds on and 20 seconds off, and the weight is the same. So we're feeling that that's, you know, about the right amount for a person. You're just wanting a little bit more than what the head may weigh, okay? The guidelines, so here they are. We're just reiterating. The force is 25% of the patient's body weight increases the length of the lumbar spine, right? So then when we look back, those are the ones where you're getting the decreased muscle spasm or the disc problems or soft tissue. So when we're doing the 50%, that's when you're getting that joint distraction of the epiphyseal joints. With the cervical spine, it's 7% of the patient's body weight to distract the cervical vertebrae. And then again, it's about 11 to 15 pounds to get that increase in length of the cervical spine.